Plantar fasciitis is a painful condition of the bottom of the foot in the area of the arch, but very often and more specifically at the front of the heel. If you have a nagging or severe heel pain in one foot, which might actually get better while walking, if it's worse, sometimes excruciatingly worse when first standing and taking the first few steps after getting out of bed or after any prolonged period of rest, listen up. In this edition of Foot Pain, Foot Comfort, we'll be talking about the basics of plantar fasciitis. Welcome back. I'm Denny Schreffler, a retired podiatrist, a medical and surgical foot specialist. Foot Pain, Foot Comfort is here to discuss foot problems and complaints in easy-to-understand concepts. If you're experiencing something that we talk about, I'm here to give you possible solutions to discuss with your medical foot care specialist. If you find something useful here, please subscribe and like, and please let your friends know about our channel. Be sure to stick around to the end of this short video where I'll explain what has been my absolutely favorite medical term for over 40 years. Thanks for joining us on Foot Pain, Foot Comfort. If you have any questions, comments, or ideas for future videos, please let us see them in the comments section. If you hear something with which you have a differing opinion, please let us know in the comments. I'll respond. Now, plantar fasciitis, plantar, P-L-A-N-T-A-R with an A, not an E near the end. Plantar refers to the bottom of the foot, the sole. Also commonly heard when we talk about plantar warts. Fasciitis means an inflammation of a fascia, and fascia is a type of connective tissue that usually surrounds, encases, connects, or strengthens body parts. The plantar fascia is a strong band of tissue that connects the heel to the forefoot and provides support and shock absorption to the arch. It's not entirely accurate, but it's useful to think of the plantar fascia as a bowstring, with the arch being the bow, strung from the heel to the forefoot, and keep in mind that the attachment at the heel is narrow and localized, and that the attachment in the forefoot is broad and diffuse. For this video, we'll consider heel spur and heel spur syndrome to be the same as each other, and most of the current usage of plantar fasciitis to be in the same category. It's my opinion that actual inflammation of the plantar fascia, as demonstrated in this image, is much less common than is discussed on the internet. Here's an x-ray of a foot taken from the side, which shows a normal heel. Here's another foot, and notice the pointed projection from the bottom of the heel which extends toward the toes. Here's an x-ray of another patient, and it doesn't take much imagination to see why that little projection can be called a heel spur. It might take even less imagination to come to the conclusion that walking or standing on such a sharp and misplaced thing would be painful. However, it's very common to have x-rays that show a large and sharply pointed spur, like the ones we've just seen, which are not painful. These patients, however, often have a past history of heel spur symptoms. The other side of that coin is that it's also common for x-rays of a symptomatically painful heel to show no sign of a bony spur. What's happening is that the pain of plantar fasciitis at the heel spur, does not come from walking on the bony protuberance or the spur. It comes from the mechanics involved in the formation of the spur and the tissues that are being injured. As I mentioned, the plantar fascia attaches to the heel bone, and like almost all our bones, the heel bone is covered in a thin sheet of tissue called the periosteum, which is rich in blood vessels, nerves, and cells which are responsible for bone growth when we're growing and bone repair when there's been damage. Basically, if the bowstring, the plantar fascia, is being stretched because of the flattening of the bow, the arch, the plantar fascia is tearing the bone covering away from the heel, resulting in microtrauma, pain, and formation of new bone underneath the displaced periosteum. The common notion that the fascia itself is inflamed or painful, or that it has been torn near the heel, as I've already mentioned, is almost certainly wrong. In another video, we'll talk about exercises, stretches, and devices that can be beneficial for plantar fasciitis, both short-term and long-term. And we'll talk about shoes and shoe fixes that might help. There is a particular and commonly suggested stretching exercise for plantar fasciitis to absolutely avoid, and there are some common bits of advice that need to be approached carefully or should be completely disregarded, but these require explanations that we'll get into in a future video. If you have specific questions about something that might be in this category, I'll try to answer them carefully in the comment section. I've left surgery for last because any medical specialist should apply conservative treatment before considering surgery for heel spur plantar fasciitis. Okay, here's my favorite medical term, post-stasis dyskinesia. It means that something hurts after it hasn't been used for a while. You might see it on the internet as post-static dyskinesia. And as you will hear me say over and over, avoid shoes that cause problems, wear shoes that promote foot health. I'm Denny, this is Foot Pain, Foot Comfort. Please comment if you have something to add or have a question, and please subscribe. Thanks for